Good afternoon, guys. Now I've got discussion B for you. We are discussing dealing with the loss of a limb, which means that somebody lost a leg or a arm or things of that nature. So let's get going on the presentation I made for you. Let's go. Dealing with the loss of a limb can be a challenging experience that affects both physical and emotional well being. Here are some strategies to help cope with limb loss. Acknowledge your feelings, recognize and express your emotions, such as shock, grief, or anxiety, to begin the healing process. Seek support. Connect with family, friends, or support groups to share experiences and gain emotional support. Set realistic goals. Establish achievable goals to regain independence and maintain a sense of purpose. Utilize technology. Use mobility aids and prosthetics to enhance independence and improve quality of life. Engage in rehabilitation. Participate in rehabilitation programs to learn how to use prosthetics and adapt to changes. Maintain mental health. Seek professional help to, for mental health challenges such as anxiety or depression to support your recovery. These strategies can help individuals navigate the emotional and physical challenges of limb loss and promote a fulfilling life post amputation. Consult a qualified healthcare professional for personalized medical or mental health advice before making treatment or rehabilitation decisions. The article describes limb loss as a life altering event that affects the body, mind, and identity, relationships, and daily functioning. It explains why emotions such as grief, fear, anger, and anxiety are common, and it outlines evidence informed strategies that help people regain stability. Give me 1 second, guys. Papers are stuck, so I have to get them apart. Give me 1 minute. Independence and meaning. It also highlights the importance of rehabilitation, social support, and adaptive tools, showing that many people rebuild fulfilling lives with time and the right resources. How limb loss typically affects someone. Emotional impact. Losing a limb can feel like losing part of one's identity. People may struggle with self esteem, body image, or fear about the future. Early on, many many experience shock, numbness, or disbelief, followed by waves of anger, sadness, or guilt. These reactions are normal and often soften as people regain control and adapt. Physical and functional changes, mobility balance, and daily routines often need to be relearned. Some people temporarily rely on others for basic tasks. Phantom limb sensations or pain, itching, pressure, or sharp discomfort are common and can disrupt sleep or mood. Social and vocational effects, age, personality, and occupation shape how someone adjusts. A person whose work depends heavily on physical function may face more emotional strain. Strong social support, family, friends, peers, and clinicians consistently predicts better emotional outcomes. Vocational rehabilitation can help people retain, re enter the workforce, or shift careers in ways that restore confidence and financial stability. Core coping strategies. The page recommends acknowledge feelings, name emotions, reduce their intensity, recognize grief, anger, or fear, helps people move through the healing process rather than getting stuck in it. Express emotions, creative outlets like journaling, painting, or music can help release difficult feelings. Talk therapy offers structured support for processing trauma, grief, and identity changes. Connect with others. Isolation worsens. Distress, supportive relationships, and peer groups, especially those with lived experience of limb loss, provide validation, practical tips, and hope. Organizations like the Amputee Coalition offer virtual and in person connections. Find purpose and set goals. Purpose anchors people during uncertainty. Small, meaningful goals, learning a new skill, volunteering, or returning to a beloved activity help rebuild motivation and self-esteem. Create a daily routine. Predictable routines reduce anxiety and help people focus on process rather than loss, including physical, creative, and social activities. Supports emotional balance. Adapt hobbies and activities. Many hobbies remain possible with adaptive tools, prosthetic attachments, or modified techniques. Swimming, adaptive sports, uh, guided, prac- guided practice sessions help people safely rebuild stamina and confidence. Use available resources, nonprofits, scholarships, veterans services, and community programs. Offer emotional support, financial assistance, and practical guidance. These resources reduce stress and expand opportunities for independence, rehabilitation, and medical care. Multidisciplinary rehab. Recovery typically involves physical therapy, occupational therapy, prosthetic training, psychological counseling, pain management, and vocational support. This team based approach helps people regain mobility, manage symptoms, and rebuild daily routines. Timing matters. Early prosthetic fitting and, consistent rehabilitation are linked to better emotional adjustments, improved body image, acceptance, and faster return to independence. Rehabilitation also teaches strategies for safe movement, wound care, and adapting their home environments, the home environment, managing difficult symptoms, and unhelpful coping. Phantom pain, phantom limb pain. More than half of people with limb loss experience phantom sensations or pain after ruling out complications like infection or circulation issues. Clinicians may consider options such as attend therapy, neurostimulation, acupuncture, or meditation or surgical revision when appropriate. These approaches aim to retain nerve pathways and reduce discomfort. Maladaptive coping styles. Overcompensation, refusing help, avoidance, withdrawing or using substances, and surrender over relying on others can slow recovery. Therapy helps people replace these patterns with healthier strategies that support autonomy and emotional resilience. Practical takeaways: support and rehabilitation are as essential as medical treatment. Emotional recovery accelerates when people feel connected, supported, and engaged in meaningful routines. Grief after limb loss is normal and highly individual. People move through stages at different speeds, and acceptance often grows as they retain skills, confidence, and community. Adaptation is a process, not a single moment. With time, many individuals experience psychological growth, greater resilience, deeper appreciation for life, and stronger coping skills. The page describes limb loss as a life altering event that reshapes a person's physical abilities, emotional landscape, identity, and daily life. It stresses that the psychological impact is often deeper and more complex than people expect. Grief, fear, anger, and a disrupted sense of self are common, and recovery requires far more than wound healing or prosthetic fitting. Emotional adjustment depends on support, rehabilitation, and the gradual rebuilding of confidence, purpose, and independence. Common psychological effects. Many amputees grieve not only the loss, the limb, but the version of themselves they were before the injury or illness. This grief can resemble bereavement with waves of sadness, frustration, and longing for lost abilities. Anxiety and fear, concerns about mobility, safety, independence, and how others will react often surface early and may persist during rehabilitation. Depression and low motivation, persistent sadness, hopelessness, or withdrawal can emerge as the reality of long-term adjustment sets in. Body image and identity shifts. Losing a limb can disrupt a person's sense of who they are. Some feel unfamiliar in their own bodies or struggle to imagine a future self. Social withdrawal and stigma concerns Fear of being judged, stared at, or pitied can lead people to avoid social situations, deepening isolation. What shapes how someone adjusts? Quality of social support, strong, compassionate support from family, friends, clinicians, and peers is one of the most powerful predictors of emotional recovery. Access to equipment and home adaptations, mobility aids, ramps, stair lifts, and well fitted prosthetics help restore autonomy, reduce frustration, and rebuild confidence. Personal factors, age, personality, coping style, cultural background, and pre existing mental health conditions influence how quickly and how comfortably someone adapts. Life roles and responsibilities. People whose work I people's who people whose work or identity relied heavily on physical ability may face more intense emotional disruption. Evidence informed coping strategies. The page recommends professional counseling. Therapy provides a structured space to process grief, trauma, identity changes, and mood symptoms. Rehabilitation, physical and occupational therapy. Rehab, rehab helps people re, uh, relearn movement, build strength, and regain independence, which directly supports emotional healing. Peer support and community groups. Hearing from others who have lived through limb loss normalizes feelings and offers practical, hopeful guidance, goal settings, and small achievements. Celebrating celebrating incremental process, standing longer, navigating a room, mastering a new tool helps rebuild motivation and self-worth. Mindfulness and relaxation techniques like breathing exercises, meditation, or guided imagery can reduce stress and improve emotional regulation. Rehabilitation equipment and long-term care. The article emphasizes a multidisciplinary approach that includes physical therapists, occupational therapists, psychologists, uh, prosthetics, and social workers This team addresses both the physical and emotional dimensions of recovery. Early prosthetic fitting and personalized rehabilitation plans are linked to better outcomes, including improved mobility, stronger self image, and faster return to daily routines. Long term psychological care may be needed to manage chronic pain, phantom limb sensations, or trauma related symptoms. Managing persistent problems and helpful coping, phantom limb pain, and sensations. These can be distressing, and long lasting. Clinicians may offer pain management strategies, uh, desensitization techniques, or therapies that retain that retrain the brain's sensory pathways. Maladaptive coping, avoidance, substance use, or overdependence on others can slow recovery. Therapy helps people replace these patterns with healthier and more empowering strategies. Identity reconstruction. Over time, many amputees rebuild a sense of self that incorporates their limb loss without being defined by it. Support groups and counseling are especially helpful here. Practical takeaways. Most important, emotional recovery depends as much on support, equipment, and tailored rehabilitation as on medical treatment. Grief, fear, and identity disruption are normal responses, not signs of weakness or failure. With time, many people regain independence, discover new strengths, and even become mentors or advocates for others navigating limb loss. Hope and resilience often grow gradually as people rebuild routines, relationships, and confidence. Okay, guys, that's B for you. I'll be back on shortly with C. I'm going to take a little break for myself, and then I'll be back on with C for you. For now, get a wellness. Take care, folks.